share the PowerPoint with notes, just so that you guys have a little bit of something to follow along with. I think that'll be the easiest thing to do. So first, I just want to welcome you guys. We have about an hour to talk about some of these things on the agenda. I'm going to introduce some of our team members that are on. We're going to go over the purpose and background of the contracts, the scope of service, a little bit of reporting expectations, the reimbursement process, talk a little bit about technical assistance, and then like the timeline of the contracts. So real quick, I don't know if James is on. I don't believe he is, but he is our addiction treatment and prevention lead. He kind of oversees the entire continuum when it comes to this kind of stuff. I'm more of the training and technical assistance lead. I'll be assisting in providing technical assistance for these contracts. Callie is new. She is just started with our program a couple months ago, I believe. She will be the new administrator and contract management for these contracts. So your monthly reports and your RFRs and things like that will go to Callie. And then Sarah Cap, she is our parents lead kind of coordinator now. I don't know if she's on, but she will be doing a lot with the Parents Lead program, and she will be your point of contact for that. So this is who I've heard from in my email for the community contracts. We have a lot this year. We have quite a few new contracts. We have a lot of continued contracts, even some partial implementation, but we have a lot of grantees across the state, and we're covering almost every single county when it comes to prevention. So that's really good to see. So thank you for taking up this opportunity. I know you guys are busy. So real quick, I'm going to just go over what the Behavioral Health Division is and some of our goals and how you guys fit in. So like real quick, just so we're on the same page, behavioral health is health. That's really how we identify it. It's an emotional well-being, mental, and it's the choices and actions that affect our wellness. And our division covers almost it covers the entire continuum of care. These are some of the models that we follow. So you guys hear us talk about the continuum of care. We want to increase community-based services, prevent criminal justice involvement. These are just some of the ways that we're trying to reform the behavioral health system. Behavioral health is very big. We have about 40 to 50 employees now. I can't even keep track because we're growing so fast. And we have a lot of responsibilities. These are just some of the things that we've identified in our strategic plan overall with the Behavioral Health Division of what we're kind of focusing on. Community behavioral health prevention and promotions, children's behavioral health, addiction programs and policies, mental health programs and policies. So like we cover the entire gamut. You are a sliver. These contracts are just a sliver in the prevention realm. Really what we found out is that prevention follows a public health model. This is all through research, I guess, not what we found out, but it follows a data-driven process. It focuses on reducing risk factors and strengthening protective factors. Our contracts are set up to require a multifaceted approach. We look at local conditions and like trying to impact across the lifespan. And this is what we have for like just a summary of our prevention strategic plan with the Behavioral Health Division. We are increasing implementation of effective prevention statewide. We've identified that there are some gaps there, and that's what we're trying to do is just implement more effective prevention statewide. We want to decrease underage drinking because when we look at the data, underage drinking is still one of our biggest problem areas that we have. We want to decrease adult binge drinking. That too is very high. We were ranked either 1 or 2 in the nation when it comes to adult binge drinking, as well as underage drinking, I believe. And then we want to decrease opioid misuse and overdose and develop our early intervention and capacity. Someone I don't have in here on this meeting is Amy Lease. She is kind of our our kind of lead when it comes to early intervention and stuff. So you'll learn more about that later on, but we're trying to develop that a little bit more. Here, Bill, I'm going to just reduce you there so you're not on the recording the entire time. So then the purpose of these contracts is really to support community level evidence-based substance abuse prevention implementation. So what we're saying is that you are a piece of the bigger puzzle in the strategic plan for helping us make impacts when it comes to substance misuse and prevention. So we've identified that we need capacity for sustaining prevention, and our priority areas again are that underage drinking, adult binge drinking, other substance misuse. And this is identified through data. The only area that we don't really focus on as of yet is tobacco prevention, and that's because we have, well, a tobacco prevention grant, and they are part of us now, but we're still working through how that's going to look. But with this funding from SAMHSA, we are saying that it's underage drinking, adult binge drinking, or an other substance identified by data. This funding, again, comes from SAMHSA. A lot of you are familiar with SAMHSA funding. It has to focus primarily on promotion and prevention. We cannot go into the realm of treatment and recovery with this funding, unfortunately. Now with SOAR funding, that allows us to cover the entire continuum, but they just haven't caught up when it comes to this level of funding here that you're receiving for these contracts. So again, this is just primary prevention and promotion. So some general expectations that are in the scope of service that we have with these contracts is there has to be collaboration. You have to participate in state training and technical assistance. There'll be quarterly meetings, and in these quarterly meetings, you will be presenting on some of the things that you're accomplishing with the funding. We used to hold those, there's specific dates, and we'll just kind of put those on your calendar. I send you team invites. And then there's a requirement for the SAPS training. This is that substance abuse prevention skills training. So every 5 years, you have to attend or have somebody attend this skills training. It really is the fundamentals of prevention. It's a very good training. It's about 4 to 5 days long, depending on like what the online course or whatnot. But we are going to try to set up a SAPS training for early next year so that you guys can attend if you need it. A lot of you have already attended it, but there's a lot of new people too. And then we require monthly reporting. We'll talk about these later on. So we have people on here that have new contracts. We have some with continued contracts, and then we have some that are partial implementation contracts. Real quick, the new contracts. These new contracts, I think there are, let's see here, First District, Grand Forks, Pembina, Ransom, Richland, and Sargent are all new contracts. There are a few different requirements that you will have to follow. The first one is really that assessment and planning phase. We'll talk more about this here in a little bit, but then there's the other contracts are all these continued contracts and partial implementation. That's the rest of you. And we'll talk about this in more detail as well. So there's 2 phases for this continued implementation phase and evaluation phase. These are for the these ones right here, the implementation contracts. Okay, so if you are a new contract, those 6 I listed earlier, you will have the assessment and planning phase. This is something that we just require. It's a process that we have to take for SAMHSA funding, and you are going to provide us with a logic model. It's really just your roadmap of what you plan to do with the funding for the year. You're going to identify your problem statement. This will be that substance that you're going to focus on, that one overall substance. Is it going to be underage drinking? Is it going to be adult binge drinking? What does your data say? Because you're going to support this through your data. Again, this is going to be most likely statewide data because we don't have it broken down into some of the county level data. And then after you've identified that problem substance, is it going to, like, let's just say it's underage drinking. You're going to take that and say, why is underage drinking a problem in our community? Is it high retail access? Is it high social access? Is it the community norms? That's the things that you're going to identify here with the but why. So high social access could be like kids are getting it from older adults. We know that's happening a lot in North Dakota, and a lot of our grantees are actually focusing in that area. The next thing you're going to identify is the but why here. This is really that behavior that you're seeing in your community, and you're going to want to be able to draw a picture of what that looks like. So if you have underage drinking as your problem, but why, it's because of social access. There's a lot of social availability of alcohol. What does that look like in the community? That social access looks like underage kids are getting alcohol from older kids and they're drinking it in the house. That is a very specific behavior that you've identified through your data to actually focus on and try to make a difference. We need you to be very specific about what that behavior is, because the more specific you are, the better it is that you're going to, or the more likely it is that you're going to show outcomes. So the way that you're going to kind of determine your local conditions, and again, this is for the new contracts, because the implementation contracts, they've already done this, they've already have their strategic plan and logic models. This is just for the new contracts, this assessment and planning phase. In order to look at that local condition, you're going to want to maybe do a focus group, or you want to talk to your key informants. This could be law enforcement, this could be public officials, this could be highway patrol, whoever you want to talk to figure out what's really going on with underage drinking or adult binge drinking in your community. It could be a survey. I know that some of our communities do surveys on adult binge drinking. Then there's environmental scan. So if let's say that you believe retail access is an issue, you can do an environmental scan to determine what retail access looks like in your community. And we have resources for all of these things. So just reach out to me when you get to that point. So after you've done some of that data collection, you determine what behavior you're going to focus on. You're going to also identify what strategy you're going to implement and what activities you're going to do to implement that one overall strategy. So this contract has you identify this one overall aim that you're going to want to target. This is most likely a policy, a protocol, or something that you want to change that will impact the environment. And you can also choose to what community you're going to work on, things like that, but we can talk more about that later. But the reason we're doing this, where we're having you choose one environmental strategy to focus on, is because we want you to have a clear vision. We learned through the PFS grants that we had earlier that if we give you a really narrowed focus, you're going to make more of a difference when it comes to change and behavior change. So then it comes down to activities. So these are two things you got to keep separate. So your overall strategy is that environmental change that you want to make, and the activities are everything that you're going to do to implement that environmental change. So let's just say that you're going to do a social host policy. You want to implement a policy. All the activities that you have to do to implement that policy are things like you have to provide information to the public. You have to build capacity of your coalition. You might have to build your own capacity on what the policy is. All those individual activities are the things that you have to do to implement that overall environmental change. And when you're providing us the logic model, be able to describe your goals and objectives and what you're going to do to reach your outcome. Did you factor in importance and changeability? Is your strategy linked to your data? Are the activities related to that environmental change? Are the things that you're doing going to change what you said you want to change? That's really what we're going to look at when we review your logic model. So now, like I said before, the contracts that are the continued contracts, they're going to continue just working on the implementation phase. These are all, again, just your activities and things that you're trying to implement to reach that broader environmental change. Because again, you've already submitted your assessment and your logic model. Now, if you want to change that, let me know. You can always submit us a revised logic model, and we can talk about how that works now with your activities and your reimbursement. So an important part of your contract is going to be what's called the attachment A. This is kind of a menu of activities that you can implement, which target that environmental change. And these 7 strategies are proven effective in implementing environmental changes. And really, it's just a multifaceted approach to implementing prevention. That's really what these are. So like that like our reimbursement and our monthly reports and everything are actually like modeled after this CADCA 7 strategies for community change. We have areas where you report about providing information, enhancing capacity, providing support and things like that. And then ultimately that environmental change. You probably haven't seen these yet because you haven't received your contracts. We're a little bit behind on all the contracts and even requests for reimbursement. So just know that we're trying to catch up. We got a little bit delayed, let's just put it that way. But this is where you're going to get your attachment A, and you're going to actually fill out your problem substance. You're going to say that it's either underage drinking, adult binge drinking, or other substance by data. You're going to give us what that is. You're going to describe your behavior that you're looking to change. And then you're going to tell us the strategy that you're going to implement. What policy are you going to implement? What environmental factor are you going to implement? What is that one thing that you're going to try to implement? Because then everything you do after that, it should be trying to target that very specific local condition or behavior in your community that you're seeing. So for example, like if you found out that underage drinking is your problem, and then you found out that the but why is that social access, what does that really look like in your community as youth are getting alcohol from adults age 21 and older and drinking it at shop parties? That's that very specific behavior that you can draw. And a lot of our communities in North Dakota are actually dealing with this right now. This is the one focus. It's like youth are getting alcohol from older kids and older family members, older adults, and they're drinking it at the house or they're drinking it at the shop. That's a very specific behavior. So what we're trying to do is we're actually trying to increase penalties for adults who provide alcohol to youth. That is that environmental factor that we're trying to change. So then all of these other things listed below here are actually the activities that you're going to do to try to impact or make that environmental change. So some of the things in information dissemination are, we're going to provide radio messages to the public on what the laws are around providing alcohol to minors. We're going to do some Facebook posts and we're going to talk about the laws. I might even share like a video on what penalties are and things like that. You might host a community forum. You might share information at a coalition meeting. You might implement the Not in My House campaign. So all these things in information dissemination or providing information should focus around that environmental change of what you're trying to do. And then attachment A provides reimbursements for each one of these different activities that you're implementing. So now let's talk about enhancing capacity or skills. This is where you're going to have to build your capacity and maybe the community's capacity to implement those activities. So law enforcement training might happen here on what source investigations are. Now, we can't directly pay for enforcement. That's kind of like a little stipulation there, but it allows us to kind of roundabout pay law enforcement for those trainings. We can train law enforcement, we just can't pay for their time. We can talk more about that too. But this could be maybe a webinar for a coalition. This could be maybe a webinar for yourself to help build your own capacity on what this law or this policy might be. This could be for the collection of new data to help guide your efforts. So there's a lot of things here that fall underneath capacity and skills building. Support is really creating opportunities to support people to participate in activities and strategies that reduce risk or enhance protection. So it could be like hosting alternative events for youth during high-risk times of use, evidence-based curriculums for youth. This could be parent classes. These are all things that provide support for the implementation of that environmental factor or that environmental strategy that you're trying to work towards. This requires a plan. So I should talk about this. So we have some planning templates, and if you're going to do something underneath this providing support, you're required to submit a planning template to us. Fill it out, tell us what you're going to do, what your goals are, and then submit that to us, and then you can do these alternative activities and things like that. We just need to know that what you're doing is still focused on that bigger environmental change. Then you have enhancing access and reducing barriers. This is really just anything related to improving your systems and processes to increase the ease and ability and opportunity to utilize the systems and services. So this could be like childcare for those that want to attend a server training. This could be transportation to get people to your community forum. These again need to be like pre-approved by the state, and this could be a very customized reimbursement if you decide to focus on an enhancing access or reducing barrier strategy. The next one is changing consequences. So this would be like there's strategies that increase or decrease the probability of a specific behavior that reduces risk or enhances protection. So this could be like a texting tip line. So if you have identified underage drinking, your local condition is youth are getting it from older kids or older family members, then you would want to promote the texting tip line as a way to increase a consequence, as a tool to report adults who are providing alcohol, right? This could be incentive for adults who submit tips. So, or like, let's just say you found out that retail access is your issue, and that you're finding that our retailers are not carding properly and they're not confiscating the fake IDs. This could be providing $20 stipend to any retailer or bartender who captures a fake ID. That's the consequence change. This is all supported in your contracts. Physical design change, this is something more permanent to the physical design of something, or this could be like permanent signage in the parks, talking about underage drinking and providing alcohol to minors. It could be cameras in retail establishments or parking lots to kind of increase that prosecution for the adults who are providing alcohol. This could be the Not in My House campaign materials that are more permanent, like stickers on all of the materials, or I mean stickers on like the windows of the establishment or even on the boxes of the alcohol. And lastly, we have that environmental change. This is really that protocol, that procedure, that lasting change that impacts the environment. These are proven to be the most effective strategies that we have in prevention. They're longest lasting, the most cost effective. If you can implement a policy or a procedure change, it will last a long time and change behavior. This could be like law enforcement adopts a new protocol for enforcing the laws of providing alcohol. The court could make a requirement of a minimum fine in community service. These are some of those protocol changes that are supported through these contracts. Now that's a lot to go through, but that is really attachment A in a nutshell. It really just divides out a lot of the different things that you can do to support environmental change and gives it a cost structure. The last thing we kind of have to talk about with these contracts and some of the things that you're going to be implementing is these contracts require the implementation of Parents Lead activities, at least 3 per month. This could be Facebook posts about Parents Lead. This could be sharing resources about Parents Lead. This could be like hanging up posters for Parents Lead. And we have a special section in the report where you would just say that these are the things I did this month for Parents Lead. And we have a really good community toolkit online. I don't know if that's the new PDF or not because we're merging websites and things are moving. I will make sure that that still links to the Parents Lead Toolkit, but it gives you ideas of what you can do locally to implement the Parents Lead program. And then we can provide reimbursement for that. And I believe it's $1,500 a month for the implementation of those Parents Lead activities. So with that, we'll talk real quick about the monthly reporting. Excuse me. Okay, so the monthly reporting is an Excel document that we'll provide to you shortly. We have to edit it yet and revise it for 2022, 2023. But the main thing that you have to think about is that it's an Excel document and we have specific tabs for each month of implementation. Don't send us an Excel document with a new tab filled out each month. We want you to use the same Excel document and just fill out a tab and resave it. That way we have everything kind of saved within one Excel document. So pay attention to those tabs at the bottom of the Excel document. And specifically, we have your strategies listed out here. That's your attachment A will be listed out. And then you have all the different months right here for what you're going to fill out in each tab. And the report each month is kind of broken down by category. So it's just those categories that I ran through. So you have your Parents Lead activities that you'll report on, and then any information dissemination activities and so on. So it's kind of just broken up in the different sections that we just discussed. You'll want to pay attention to the dropdown. There will be kind of like a hidden dropdown feature, whereas if you hover over the cell, that little drop-down icon will show up right here, and then it'll have the strategies listed from attachment A. And it even shows you up to the reimbursement amount here. So you'll be paying attention to that. So once you do an activity, you're going to report to us what you actually did. So if it was for radio ads, you would report for radio ads. If it was social media posts, it'd be social media. What's important and what we really need you to focus on is providing a good description of what that activity is. We have to take what you do and we have to code it to what SAMHSA wants it to be coded at. And they follow 6 categories. And it's like information dissemination. I don't even remember them anymore because I haven't looked at it forever. But environmental change, like there's these different things that SAMHSA requires us to code your guys' activities into. So provide us a really good description of what you're doing so we can do that. It'll help us out greatly. The next thing is total hours. Why we have this is because SAMHSA requires us to report the total number of, or amount of effort that you spend in each one of their categories. So if you're doing information dissemination, we need to know what that effort looks like, and then we have to report that to SAMHSA. So that's why we have the total hours here. And just give us your best estimate. So if you've done 8 Facebook posts in the month, we just kind of need to know how much time did it take you to create those 8 Facebook posts and then post and monitor and report. Just give us your best estimate. Then we need like the number of people reached. These are your process measures, the number of people reached, the number of participants, or the number of items handed out. You do not have to fill, so like if you're doing radio ads, you do not have to fill out like number of items handed out or number of participants because you wouldn't have that. You would just have the number of people reached. And how you calculate this is if you had 4 radio ads and your radio reach is 20,000, you would take that 4 times 20,000 to get you that 80,000 reach every month. Okay, if that makes sense. And then the last column is just for the reimbursement. So you fill out what you are asking or requesting for reimbursement. Your reimbursement should match what you have in your RFR. So if you're hosting a booth at a community event, we pay $200 for that booth, right? And then here's like where you describe, held a booth at the middle school and promoted school policies and school policy change or whatever. Took us 3.5 hours. We had 245 people reached and we handed out 25 resources during that event for a reimbursement total of $200. Okay, so that's kind of how it's filled out. Again, just be very descriptive when it comes to describing what you're doing. This helps us code what you're doing. The last tab on the monthly report is really a summary tab. So when you're filling out your activities and the things that you're doing and you're putting in your monthly amount in your drop downs, what happens is it tallies it at the end. So you can then just go back and select this amount for your RFR. It also gives you a summary of your reach, your participants engaged, and the number of items disseminated. So it's really nice in that instance that it just kind of gives you an outline of what you've done so that you can help with your request for reimbursement and things like that. So the implementation phase, for those of you that are still in the implementation phase, we're reimbursing the same. It's up to $8,000 per month. It's $1,500 for the parents lead activities, $6,500 for other activities. You can go outside of that realm with pre-approval. So just know that if there's something specific that you want to do, you can request like a change in that monthly amount, depending on what you're doing. But like what you'll submit to us is that SFN 1763. It's the same thing that you've submitted to us before. For those new contracts, that's the link to the form. It's really just a fillable PDF, and it's pretty simple to fill out. And I could go over that with you if you ever need to. So the last thing to talk about is that evaluation phase. And I won't go into great detail with this. I have a lot of slides on what evaluation is, but really it's just the last month of the contract. That September is going to be for your evaluation phase. What we just need to know is what you did working, or did it work? Can you show us any kind of outcome measures or intermediate outcomes or anything like that? It's really just a summary of all the work that you've done, and it's kind of like a pitch to, can you provide us more funding to keep going? It's really for that. And here's like some of how the logic model relates to evaluation, things like that. I won't go over this because I want to leave time for questions. I know I'm going through this kind of quick, so I can bring up all this stuff again, but we will have an evaluation meeting towards the middle of the grant or contract so that you can get a better understanding of what you're supposed to do. But really, you're just going to measure the different areas, like your problems, your but why, your any variables, and then your local condition. We want you to measure that and see if you're making any progress. Okay, it's the last month. It'll be like the month of September, and there'll probably be a different report for that, just to let us know that you're working on some of these things. And we might not even have a monthly report for that. It might just be that you provide us that evaluation report at the end. It's important to know that we're holding $5,000 back on the contract in order to reimburse for that evaluation phase in the month of September. Okay, so for some technical assistance stuff, we have our state staff here that are here to help you guys. We are doing what we can. We are very busy. Callie just started, so that will help us out a lot. We are still trying to hire one more prevention administrator. So that should get us back to full capacity. So I apologize, I haven't been available a whole lot. I've been very busy just trying to maintain and keep my head above water. So we're expecting that this next year will be a little bit better. Like we'll be able to respond a little bit more, we'll be able to provide you more resources and even some more proactive trainings and things like that. Like I said, we have the SAPs coming up, hopefully early in the year. For anybody who needs it. And then we're going to still try to get a training and technical assistance contract out there to provide some more in-person quarterly meetings with you guys, because I really miss seeing you guys in person and doing some of the things that we used to do with like our training and things like that. But just know we have our website. This again is being moved, so I'll have to try to find you the new website link. We have PowerPoints, recorded videos. I'll provide you the video recording of what we did 2 years ago because it covers more of that evaluation and things like that. We are requiring quarterly grantee presentations. So this is something that we have in the contract where every quarter we'll get together and you'll present just real briefly what you're working on, the activities that you're implementing, tell us about any barriers or any successes that you're doing. It really helps us all learn. And I think what I'm going to have to do is block maybe 2 hours now because we have so many people working on the prevention contracts, but really it's just 5 or 6 slides that just covers kind of the work that you're doing. And then we have the PTTC. I believe I sent everyone an email showing the PTTC, kind of introducing who they are and how they have an onboarding document, or actually an onboarding class that you can go through. And it has recorded videos, it has like handouts, it has its own website. So if you haven't seen that, make sure you go to that. It's really good information there, really good videos and stuff like that. Talks about the SPIF process, prevention history, fundamentals. It even covers a little bit of the SAPs. So I would encourage you to do that. And otherwise, just reach out to us. There's no wrong person to contact. You can contact us anytime. If there's specific resources you're looking for or any training that you're looking for, we can help you with that. So
there's a question in chat. Will the grant cover the cost of the SAPs training?
Yes. Yep, it sure does. And that's in attachment A. So here, I'm going to try to bring up my teams again so I can see you guys. Yep. So attachment A has very specific things for capacity building, and SAPs will be one of those. And I think we left it off of like didn't provide a whole lot of details with SAPs because we can determine what that's going to look like for each of you. So it could be up to $1,000 a day. It could be, just kind of however it's determined. But yeah, our contracts do support that training. All right, so let's open it up to questions, you guys. What are some of your questions? What are some things that you're interested in? Whatever you want to talk about. For a lot of you, this is something you've been doing for quite a while. So nothing real new. It's just continuing with the implementation, monthly reporting, RFRs. If you guys have questions about any RFRs for those ones that currently are under contract with us, we are working on processing those. We are about 2 to 3 months behind, not only on our part, but also on fiscals. They lost some staff and they're very overwhelmed. So just be patient with us. We'll get those out as soon as we can. So with the new contracts, is there any questions about the month of October, the planning and the assessment phase? Really, all we're looking for is that logic model. Tell us what you're going to do. Tell us what you're going to focus on. Describe that local condition really well. What is that behavior that you're going to specifically address with all of your activities that you're going to do?
This is Holly in First District. I do have a few questions. So when on this attachment A, it talks about like participate in a webinar. Do those have to be like live webinars, or when you're talking about going back and watching some recorded webinars? Is I have new staff here, so training is going to be a big piece of my work that we do here. Is that reimbursable?
Yep, all the activities that you do to build your capacity is reimbursable. Yep, it could be live webinars, it could be recorded webinars, yeah, anything like that.
Okay.
Yep. And those amounts are specifically laid out, and we have kind of monthly caps on everything, just so you don't spend too much time in capacity building. But yeah.
Right. So, and then if we have an activity that doesn't fit into this document per se, who do we get approval from if we want to add something?
Send it to Cal. Yeah,
Callie?
send it to
Okay.
Callie and myself, and then we can get you the approval that you need. Like, so for example, some people wanted to implement some environmental changes when it comes to cameras. They wanted to monitor cameras or have cameras monitor parking lots where they were having a huge lot of issues with underage drinking. And that was a strategy that we allowed through pre-approval.
Sure. Okay, thank you.
Yeah. When it comes to the Facebook posts in attachment A, it says customized posts. What that means is these are posts that you're putting out in your social media. It doesn't mean that you have to customize every single post. It means that it just has to be a new post that you put out. So it could be like forwarding reposting something from Parents Lead. It could be reposting something from a different public health unit. That counts as like a customized Facebook post. You're making it customized to your audience is really where it comes from. And you can do multiple. So like you can do 8 Facebook posts on one topic and 8 Facebook posts on a different topic. That's okay as well. But again, all of your activities should be focused around that environmental change or that specific behavior that you're trying to address. The part where we're kind of more lenient with the contracts is when it comes to those supportive strategies. So like this could be your curriculum implementation, this could be your after school program. Those are still activities that SAMHSA requires us to do. And we just need to have your plan in place to tell us what specifically you want to do. So we have some communities implementing like a drug-free dance during Halloween, right? Because we know that that's a high-risk time of use. It could be a Friday night. We know that Friday nights are high-risk times of use for our middle schoolers and high schoolers and things like that. And having that drug-free dance will keep people kind of safe is what the goal is. So we can support that kind of thing. And when it comes to attachment A, it's like we require the plan. That's a $500 reimbursement. Then we have like the actual implementation of the activity, which is a $1,000 reimbursement, and then it's the promotion of that activity as well, which is up to, I believe, $1,200 for the promotion of that activity. So when that comes all up or whatever, it's what is that, $2,700 or something like that. And then you use that funding to then pay your salary, to pay your indirect, or whatever it is that that you're going to be using that funding for. We reimburse for the activity. How you reimburse yourself and your organization is what you're supposed to do with that funding afterwards. So some questions we used to get in the past is, do we provide administrative fees, reimbursements with these contracts? Yes and no. It's yes and it's no in the fact that it's not specifically laid out and detailed as an administrative fee, but there's enough money, or should be enough money, in that funding reimbursement structure to pay yourself that administrative fee. If that makes sense. So other questions?
This is Jody from Rolette County Public Health. I'm sorry I got on late. So you might have covered this already, but will there be a updated report form sent out to us?
There will be, yes. Yep, we are working on that right now. We have to just update the monthly report to give the new dates and stuff like that on there, but there won't be a whole lot of changes. That's really all we have to do. Yep, that'll be coming out shortly.
Something just kind of briefly showing when things are due again, I guess. I know like the reports typically are due on the 10th, that kind of thing, but just so I have it in front of me again. Sorry.
Nope, that's exactly right. The 10th. Provide your request for reimbursement and your monthly report to Callie. She'll be on reviewing it and processing those. Let's see, the evaluation is the same thing. So like that, for the new contracts, your assessment plan should be the 10th of the month. So it would be, what is that? November 10th will be your logic model will be due. And then the evaluation is the 10th of the month as well. So that would be at the last month of that'd be October 10th of 2023 would be your evaluation. And if something comes up and you can't get Callie the report or anything like that, just let her know. We're pretty lenient. What we're trying to monitor for, and what we have to do a really good job of monitoring for this year, is are we on track to expend the entire funding? Because SAMHSA requires us to spend a minimum of 20% of our block grant funding in prevention, and these contracts are part of that 20%. If we don't spend 20%, we get penalized. So that's why it's important to get those monthly reports into us, because we have to monitor what our spending is every month so that we don't fall into us not meeting that 20% requirement. And I know that we approved you for what you wanted in your contract. So if you said that, Tom, I can expend, I believe, $60,000, that's what you were approved for in these contracts that we're submitting. If you said I want the full amount of $62,500, that's what we put in the contract. If you want to change that, there's still opportunity to change that. So let's say that you start getting into implementation, right? And you've determined that you can do probably more than what you thought you could. Let us know. We could maybe do a contract amendment and add some additional funding to your contract to support that work that you're doing. Same thing with your plan. So like if you submitted your logic model and your plan to us, if you want to change that, let us know. We're very flexible on that. Just give us the data and what and kind of what your focus and priority areas are going to be, and we'll work with you on getting those changes made. I believe we have 2 communities in the state that are focusing on adult binge drinking, and the rest are focusing on underage drinking. And the majority with underage drinking are like the social access to alcohol. That was kind of the main focus. We had Bismarck Burley, who was actually implementing some work around fake IDs, and they had a very successful program, and they've captured a lot of fake IDs in the last few months using forensic scanners. If you've identified that retail access, specifically the local condition of retailers are not capturing fake IDs, then that is something that you can address with your funding. Sue, are you on? I don't believe Sue is able to. I don't believe they have the capacity right now to do much more work with the prevention grant. So they were not included in our map today because their capacity is low for the prevention work right now. Seems to be a struggle with a lot of our states right now. Any other questions that you guys might have? All right. Well, just don't be afraid to reach out to us, guys. If you have questions or if you want to request something specific, just reach out to us. We'll get a hold of you and we'll respond. It's great to have Callie on board. She has a lot of skills and knowledge.
Since I'm very new, though, if I don't know the answer, I will figure it out and get back to you.
Exactly. Yeah, she has experience at the state system with contracting, grant management, all that stuff. So we're excited to have her on board.
Bill asked, can we use the funds for forensic scanners? Yes, that is something that people have done in the past. Absolutely.
Yep. That might require a special request to us. And then we're going to want to know what you're trying to impact with those. Is it going to be an environmental change? Is it going to be, what's that broader strategy that you're going to be working towards? But yes, absolutely. We can support something like that. They are approximately $5,300 a piece now. They kind of went up in price, but that's with a 5-year agreement. Oh, know that we have about, I think I have like 5 new ones left at the state. So if this is something that you're looking to implement, we do have 5 forensic scanners that I could ship out to you. I know that Jessica, I believe you guys asked for some or possibility of 1 or 2. So let us know if that's still something that you're looking for. Oh, I can't quite hear you. Did you try to talk?
Can you hear me now?
Yep, gotcha.
All this new, my computer broke down with my mic and everything, and so now I'm trying to figure this stuff out. Anyways, we do have some, and we have implemented them and kind of put them around the county and let the different bars try them and stuff, which some of them liked them and some of them didn't use them. Right now we have a grocery store that is looking at doing off sale, and they actually got a citation for selling tobacco to minors, so they asked if they could have one and use it and check it out with the possibility of maybe using it for their off sale also, which I think is great. But nobody ever wants to buy them from us. Like, they all just want to borrow them, and then when it's time to give them back, here you go. So that, I mean, it doesn't help us in the long term. The other thing I was thinking with these, is there, could we work on changing policy where in order to get your liquor license, you have to utilize these and then not sell to minors, because they think if they card them and they say they're 21, they're off the hook. There's no repercussions. We did our job. We carded them. Our system says we have to card them. We carded them.
Yes, you can work towards that policy or that goal. Absolutely. That could be supported through this grant. What they need to realize is, even though they carded them, their job is to not provide alcohol to minors. So if they are not detecting these fake IDs, they're still liable. Bismarck has identified that with them and has provided training on that, saying that you are liable. You are selling the drug. It is your job to keep the drugs out of the hands of the minors. And even if they show a fake ID, that's still their responsibility, because in the end, they sold the alcohol to a minor.
Yeah.
So,
but if you talk to these bar owners and stuff, they get a lot of their profit from selling to college students. So they feel like they've just done their job. And we have a few moms here that have college students. And I can tell you 90+% of college students have fake IDs.
Oh, yeah. It's bad, guys. It's getting really bad. Even just national studies from a few years ago was showing 33%, 32 to 33% of our college kids had fake IDs. And I wouldn't doubt in the last 4 years, it's increased by a lot, because it's the word around these fake IDs is spreading fast, and they are getting so good. They're telling these kids that there's no way you're going to get caught. You can go through any scanner you want and you're not going to get caught. And these forensic scanners specifically look for that, and they do like a 40 to 50 point inspection. They update the software. They're very good. We've caught almost, I would say, like when we run through these IDs and stuff like that, it catches about 98% of them. So, but these kids are so bold, like in Grand Forks, so you can ask Bill about this. Their police department does really good with forensic scanners, and they use them at some of their community events. These kids are so bold, they will try to provide their fake ID to the law enforcement officer so they can get a wristband, not thinking that you're going to get caught at all. And what did they catch? Like 11 at one event, I think, Bill, 7 to 11 of these fake IDs at one event.
I believe that. Yep.
That's a huge problem. And I believe Sue, when she implemented her program, Bismarck did not receive or collect one fake ID in over 20 years. Sioux implemented this program, and I believe they've confiscated now over 150 or around that a mark in just 6 months of implementing these forensic scanners.
It would be interesting if we could figure out who's making the IDs and like prosecute them. Maybe that would slow down a little bit because we confiscate them $25. They got another one. They're at the bar next weekend.
And what's happening is that they're being produced overseas. China's a big violator of that. Very hard to go after them and prosecute them. They sell them as novelty IDs. So, yeah, big problem. I would love to go after and prosecute.
Tom, what is the repercussions for using a fake ID? If you present a fake ID to a law officer, what are the repercussions other than, sorry, you don't get alcohol? Is there anything?
Yep, it's illegal. It's actually in Century Code. I believe it's either a Class A or Class B misdemeanor. What is it, Bill? Is it a Class A?
I know it's a misdemeanor.
Yeah.
In some cases, it can be. It depends on intent. Like if it was to purchase alcohol, it's a misdemeanor. If it's to get out of jail, it's a felony.
That's right. Or preventing it to TSA or anything is a different
Yeah,
is a federal penalty.
It depends on the intent of or why you're using it.
Yeah. But yeah, it's just doesn't get prosecuted a whole lot.
I was just going to say, I suppose that is a big piece. It's just a matter of the capacity to prosecute those individuals that are trying to use that fake ID. Just, maybe officers are deciding it's, at that point in time, it's not worth the effort or whatever the thought management might be. But it's, they're typically just confiscating them and going, don't do this.
And I think it comes, go ahead, Bill.
One thing Grand Forks Police Department did is they got together with the UND Police Department. So if a bar handed over fake IDs or confiscated IDs to the police department, they would go through them. And if they were a UND student, they would give them to the UND Police Department, who would give them to the dean's office, and then the dean would have a talk with those students. Because why are you using a fake ID?
That's exactly right.
And it was just kind of something that went on their record that there was no real penalty. No penalty, but then it was noted that it was a black mark on their record. So.
That's right. And what law enforcement says is it's oftentimes more of a punishment to lose that fake ID than going through the court system, because the court systems are so lenient when it comes to punishment now. Well, in a lot of instances when it comes to alcohol and things like that, that it's more of a penalty to actually just lose the fake ID and have to pay another $50 to $100 to get a new fake ID. That's some of the reasoning there, I guess. It comes down to evidence as well. I was told by a couple law enforcement officers it's hard to collect evidence on whether or not who provided that fake ID because there's limited cameras. It's dark usually when they're providing the ID, so it's hard to say that this person was the one that provided me this ID, even though their name is on it and stuff like that. You have to link that ID to the person who handed it to the bartender. But yeah, if you find out that retail access through the use of fake IDs is a problem in your community, and that's what you want to focus on, by all means, we can support that with our contracts. I believe Sue is going to be presenting some of the work that she's done at the CADCA conference as well as the SAMHSA conference. So this contract that we have in prevention can support you going to these conferences. So if there's a conference you want to go to or something like that, use this prevention funding. It has to be specifically related to what you're trying to do, though. It has to be primary prevention. It has to be related to the environmental changes in prevention, that type of stuff. So you guys haven't got your contracts yet. They're in the process, just so you know. Anybody who responded to my email is getting a contract, specifically for the amount that you requested. Any other questions? Well, good. Well, it was good seeing all of you. If you have any questions or if something comes up, just send us an email, call me. Yeah, we'll do our best to respond timely. All right. Well, we'll see you guys. Thanks for attending, and you guys have a great week. Hopefully see you
Thank
at the
you,
Behavioral Health
everyone.
Conference.